Welcome back for the second day of our PSC Partners Annual Conference and the launch of our International Collaborative Research Network. A few quick reminders. Currently, we have 2,173 patients participating in the registry, and each patient is an important piece of the puzzle. Please consider joining the registry to help our research efforts. I'd like to again thank all of our very generous corporate and communities conference sponsors. Dr. Korzenik and Pratt will tell you what to expect in today's agenda as we have another wonderful day planned. But first, I'd like to introduce Matt McMurtry, Vice Chair of PSC Partners Board of Director, who will take a moment to honor and remember those whom we have lost to PSC. I'll turn it over to you, Matt.
Thank you, Ricky. I'd like to begin by saying I'm very appreciative of this opportunity. I was very close to my grandmother, and when she passed in 1972, I remember asking my father how to handle the loss of someone so important to me. He said, first, you need to take time to mourn. This includes remembering all of the good and wonderful things that she was to you. This is the part of her that will be with you the rest of your life. But the most important thing he said was to get back to your life's work. He said, what better way to honor her memory than by helping others? The Greek Orthodox in their memorial service pray a prayer I think that applies to all our loved ones, and that is, may their memory be eternal. With those thoughts in mind, I'd like us to take a moment to remember those we have lost, remembering all the good and wonderful things that that person was to us, so that and those parts will stay with us the rest of our lives. But also, in their honor, I'd like us to rededicate ourselves to service to others, not only in our home communities, but here this weekend as we spend time with our extended PSC family. May their memory be eternal. At this point, I'd like to turn this session over to Drs. Pratt and Korzenik with my eternal gratitude for their dedication towards curing this disease. Thank you so much.
Thank you, Matt, for those meaningful words. And I want to welcome everyone. We are very happy you're all back for another busy day. We hope you were able to rest up because it will be another truly chock-a-block full program. My part was to sort of set the table by talking about what we accomplished yesterday, and it was really a great deal. To briefly remind everyone, the centerpiece of yesterday's program was the launch of the International Collaborative Research Network, the PSC Partners Initiative to accelerate PSC research. As an essential part of that launch, we called upon all stakeholders, researchers, clinicians, patients, and caregivers, participate in small group think tanks designed to allow everyone to express their thoughts and opinions regarding the areas of PSC research that are the most important to them. PSC Partners will take all those thoughts and use them to help refine the ICR network research agenda. Yesterday, we also had a wonderful session on identifying and mitigating health inequalities in PSC, moderated by Dr. Kittis Iman. And this is an important issue that will continue to be a focus of the PSC Partners team. And finally, we had a taste of the variety and high quality of the PSC research being done around the continent and beyond. And the first ever PSC Partners poster session and the outstanding poster session live presentations. Those talks range from ones focusing on the pathogenesis of PSC through the study of epigenetics to new imaging techniques to improve diagnosis and monitoring patients with PSC, to really important preliminary trials of new therapies with great potential, both drugs and, very importantly, the first diet study that we've seen. Thanks to all of you, the vibe from the day was one of community, collaboration, and hope. And I'm very excited to hear what today will bring and to set today's stage for us all. I want to turn this over to Dr. Korzenik.
Thanks very much, Dan. And it was really a wonderful day yesterday. And thank you, Matt, as well, for reminding us and rededicating ourselves to the task at hand and why it is so important. Welcome to day 2 of the conference. This should be another great day. The day is designed to really be a blend of education about updates in PSC in terms of our current understanding and ongoing research questions. In addition, we'll be providing an update on 2 important research initiatives of PSC partners. In the session after, there'll be a patient perspective session. And then we'll be talking a session with 3 state-of-the-art talks on PSC to provide a detailed portrait of our knowledge of where PSC stands currently, with excellent speakers, being Richard Green from Northwestern, Tom Carlson from Oslo University, and the NOPSC, or the Norway PSC Research Center, as well as myself, providing updates in PSC and genetics, fibrosis, the environment, and our current understanding of the relationship between PSC and IBD. While we focused on the launch of the ICRN, the International Collaborative Research Network, yesterday, we'll highlight today some other research efforts, including the PSC Partners Grants Program and informing researchers about how to apply and access that. This has been a highly productive and effective program sponsored by PSC Partners. You'll hear about another major high impact research project that needs involvement from all stakeholders here, and with a session called The Power of Natural History Data to Support Drug Development for PSC, and providing the rationale for the WIND think tank, or the worldwide integration of the natural history databases. In the afternoon, you'll hear about another critical PSC research initiative, the PSC Partners Patient Reported Outcome Measures Project, and updates from the researchers and the leads who are involved in that. They'll be leading us through updates of those 2 research initiatives later in the day. And now we're excited to begin our day with sharing PSC patient perspectives, moderated by Mary Vias, the president of PSC Partners Canada. Mary has volunteered and led the Canadian affiliate since 2015 and is a parent of a PSC patient who was diagnosed as a teen. Over to Mary and her panel.